All right, here is adenosine. A common trade name that we might come across is Adenocard. Either way, it's the same. It's adenosine. It is an antidysrhythmic mechanism of action. It's going to slow the conduction through the AV node, and it can interrupt reentrant AV nodal pathways. So, if we look right over here, this is the AV node, which I know we're going through medications, not cardiac section right now, but so you got your electrical pathways in your heart. It's all going to originate up here at the SA node, ideally, travel down through these internodal pathways, go through the AV node, it slows it down, and then it goes on out to the left and right bundle branches. Whenever a heart rate is super fast, and they're in SVT, supraventricular tachycardia, the adenosine works in that AV node and slows down the conduction, kind of blocks everything for just a few seconds and tries to reset the heart. It is pregnancy class C. Let me get that cursor back out of the way. Indications: supraventricular tachycardia, which is going to be a heart rate greater than 150 in adults, 180 in the kids. Then you can also, according to ACLS, give it for stable, regular, monomorphic, wide complex tachycardia. And what they're saying there is pretty much they're just using it to rule out any sort of SVT that might be like a aberrant conduction. Some contraindications: compensatory tachycardia, and that's kind of something I just threw in there. Like, we don't want to be giving adenosine to slow someone's heart rate that's, say they have a heart rate of 160, but they're septic or they have other issues going on that's causing their heart rate to be that high. You don't want to give it to slow it down when they're using it as a compensatory mechanism. Rule out other sources of tachycardia before you start giving this. So if they are in true SVT, another contraindication would be a second or third degree AV block, and which is atrioventricular block. So if you get that going, gone blockage or complete block there, third degree block. And then Wolff-Parkinson-White is another one. Kind of research Wolff-Parkinson-White a little bit. If you give adenosine with Wolff-Parkinson-White, it can actually increase the heart rate even more and is not a good thing. Some adverse reactions: headache, dizziness, dyspnea, bronchospasm, chest pain and palpitations, hypotension, cardiac arrest. It's always something you got to throw in there. And diaphoresis and nausea, vomiting. Big one is you just want to inform your patient that, hey, you're going to feel funny for a few minutes, just let it pass. It's going to get better. Drug interactions: methylxanthines may antagonize the effect, and dipyridamole or carbamazepine may potentiate or prolong the effects. So you want to reduce the dosing by 1/2 if they are on those two medicines. Adult dose: 6 milligrams rapid push IV, and then followed, if you need to do it a second time, you give 12 milligrams, and then also you can give another dose of 12 milligrams, depending on local protocol. Pediatric starting dose is 0.1 milligrams per kilogram, rapid push, of course, and then second dose is 0.2 milligrams per kilogram. So this is metabolized very, very quickly in the body, and that's why we have to do a very rapid push IV, otherwise it's not going to work. Like we talked about, onset 1 to 2 seconds, peak effect in 5 to 10 seconds, and then duration is only like 12 seconds. So it's metabolized very quickly. Special considerations: it's not going to convert VTAC or AFib/AFlutter. Need to be prepared for transient periods of asystole or other crazy cardiac dysrhythmia. It's really cool to watch on your monitor whenever you do give adenosine, because they will go into asystole, then you get some crazy PVCs, you'll get all sorts of weird dysrhythmias. Just know that it's only going to last a few seconds, and then they're going to go back into usually a regular rhythm, whether that be SVT again, or hopefully they'll have converted to a sinus rhythm. If a patient has a central IV line or they have a heart transplant, just know that you want to reduce that dose by half and then give it to them. make sure you document all that good stuff. And that's kind of the basics on adenosine. You'll learn all about it in ACLS as well and get very familiar with it.